Hello everyone. So this is the first video in our series regarding euthanasia and physician-assisted suicide. And in this video, what we'll be doing essentially is just getting a feel for the environment. We'll be understanding the crucial distinctions that are made in the literature. We'll be understanding the vocabulary, and just trying to get a feel for the general layout. Where is euthanasia legal? What types of euthanasia are legal? What is the difference between euthanasia and physician-assisted suicide, so on and so forth. So let's jump in and get started. So the first thing we need to do is understand that there are multiple types of euthanasia. There's voluntary, non-voluntary, and involuntary. Voluntary euthanasia is when euthanasia is performed with the consent of a competent patient. Right? So you have a patient who is conscious, they're able to give their consent, and they're competent enough that their consent matters, their consent counts. And so one way in which this could fall apart, right, is if somebody is suffering from a disease where their brain is degrading, right, so their rationality is slowly leaving them. Hard cases of dementia can be like this. Right, so it could be that this person wants euthanasia, but they're unable to give competent consent because of their illness. So voluntary euthanasia only occurs in cases where the patient is competent and they consent to the action of euthanasia. Non-voluntary euthanasia occurs when we're unable to obtain the consent of the patient. So two cases I have listed here are patients that are in a persistent vegetative state or newborns. And so if you are in a coma or persistent vegetative state, you're unable to give your consent to euthanasia. These cases have become highly contentious. They've sort of lit up the media over the past few decades. But you have cases where people go through some type of traumatic brain injury, and then they're left in a persistent vegetative state, and nobody knows what they're allowed to do with them. Right? Do we keep them here hooked up to machines until their body eventually withers away and dies decades later? Or is it morally permissible for us to go ahead and remove their life-saving treatments and allow them to die much sooner than they otherwise would if they remained hooked up to the machinery? This also happens in the case of newborns. So some newborns are born with such terrible congenital defects that they will die very soon, or they will live painful lives, and we have an option when they're born to just sort of let them die and not provide them the life-saving care they need. But obviously newborns are unable to give any form of consent, so we have to rely on the parent as a surrogate to make those decisions for them. So those are cases where we could have non-voluntary euthanasia. They're both cases where the consent of the patient is unable to be obtained. And then finally we have involuntary euthanasia, and that's where it's done against the will of the patient. So the patient is there, they're competent, they're able to give their consent, and they do not give their consent, and then euthanasia is performed anyway. So we'll primarily be focusing on voluntary euthanasia throughout these lectures. Involuntary is just sort of deemed by most, if not all, as clearly morally wrong, so we won't really be discussing that. And non-voluntary is on sort of murkier grounds. So we're going to be focusing primarily on voluntary. Just some sort of quick slides to give you a picture to go along with the idea. Here's a case of voluntary euthanasia. This man, we don't know his competence, obviously, just from this picture. We have to assume he's competent, but he's awake and able to give his consent to euthanasia. Non-voluntary might look something like this. You have a patient in persistent vegetative state. They're just unable to give their consent. And then involuntary, an easy way to think about it is the scare a few years ago with Obamacare that it would lead to death panels, right? If there's not enough money, a panel of doctors could all just approve that you need to be put to death. And it's a big, scary thing, right? But so here's a case where you might have involuntary euthanasia, right? So a person is alive, competent, functioning, and they would prefer to continue living, but doctors or surrogates or somebody else for some reason decides that they need to die anyway. And so this picture does a pretty good job of capturing like the moral idea here, right, of the person fighting back against the decision, but it's going to happen to them anyway. Okay. Now that we understand the types of euthanasia that exist, we should look at the crucial distinctions that are in the literature. Right, so it's not just that we have the difference between voluntary, non-voluntary, and involuntary. We also have the difference between active and passive euthanasia. We'll see in the next couple of videos that there are a number of philosophers who question whether or not this distinction actually exists. James Rachels is probably one of the most famous of those philosophers. They think that while there is a distinction between active and passive euthanasia, it's not something that's morally relevant, right? So it doesn't matter from the moral perspective, even though we can make this distinction between actions. But for now, let's just assume that this distinction does exist, and here's how it roughly looks. Right? So active euthanasia occurs when a doctor or another being performs an action that actually leads to the death of, directly to the death of the patient. Right? So if a doctor injects a patient with a drug that will kill them in order to allow them to die faster than they otherwise would, that's a case of active euthanasia. So imagine a cancer patient. They'll die in 6 months, but they prefer to die today. The doctor injects them with something that kills them. That's active euthanasia. Passive euthanasia is where we remove life-sustaining care to let the patient die. So this is most famously sort of exemplified by cases of people in persistent vegetative states, right? We remove their feeding tube, or we remove the other life-sustaining care that's keeping their body alive and allow them to die. So here the idea is supposed to be that the doctor isn't directly killing the patient. Instead, they're just allowing the patient to die. So that's why down here, instead of thinking it as active versus passive, you could also think of it as killing versus letting die. Okay, and then another distinction we have to get a handle on is the role of the physician. So there could be two ways the physician plays a role, at least two ways the physician plays a role in cases of euthanasia and assisted suicide. One is the physician could merely assist the patient. Whereas on the other hand, you could have the physician actually performing the action on the patient. Right, so physician-assisted suicide, or PAS as we'll be calling it throughout these lectures, occurs when the physician gives a person advice on how to kill themselves or gives them access to the drugs to do it. Right, so you could have a patient who prefers to die as soon as possible instead of dealing with their terminal cancer, but the physician is unwilling to inject the drug themselves, so the patient comes into the doctor and asks for advice on how to kill themselves. Right? What are the proper doses? What are the risks? What are the chances that it doesn't work? How can I get these drugs? Do I need to avoid any other types of chemicals to avoid bad reactions? So on and so forth. Right? So the physician has the information that can allow the person to do this as sort of quickly and painlessly as possible. And then obviously people don't have access to, well, at least not legal access to drugs. So the physician could also assist in a suicide by giving you a prescription for the drugs you need to kill yourself, but not actually administering them by themselves, right? The person gets to, or the patient administers the drug, not the physician. Whereas on the other hand, you could have physician administered or physician performed suicide, and this is just a case of voluntary active euthanasia. Right, so the patient gives their consent, and then the physician administers the drug that actually kills the patient. So now we have the distinctions between voluntary, non-voluntary, involuntary, between active and passive euthanasia, and then between physician-assisted or physician-performed euthanasia. There's also a distinction that doesn't get talked about very often between types of euthanasia based on the illness one has. Right? So the very, very common discussion of euthanasia centers around physical illnesses. Right? So terminal cancer patients are the sort of go-to case. Right? Patients who it's certain they are going to die from their illness, they're in pain or severe suffering from some other part of their illness, and they require, or at least prefer, to die earlier instead of riding out the rest of their days in this terrible state. So this is sort of the most common, and it's the less controversial of the two. But other people, and this is now legal in both, I think, the Netherlands and Belgium, they both allow euthanasia for mental illness, and this is highly controversial. So some people request euthanasia for their insufferable mental pain. And here it's not just depression, right? It's not some type of chemical imbalance. What they're worried about is mental suffering that cannot be cured by medical or psychological treatment. And we'll watch a video that goes into pretty deep detail on this later on in the week here. But there are people who suffer from really traumatic or severe PTSD, depression that's not caused by chemical imbalances, and they've gone through all of the procedures, medical and psychological, in order to try and heal themselves of this insufferable mental pain. And it fails, right? And doctors, at least a panel of these doctors in Belgium and the Netherlands, all agree that euthanasia is sort of the only option left for these people. So there's euthanasia for both physical and mental illness, although the mental is highly controversial, primarily because these people aren't going to die anyway, right? In terms of the physical illnesses, it's the case that the illness is terminal, so these people are going to die anyway. In the mental illness cases, these people will continue to live unless they take their own lives, right? Unless euthanasia occurs. So, there's the big difference between those two. And then finally, to put it all together, you can have all these different types of euthanasia, right? You can have voluntary passive euthanasia, voluntary active euthanasia, the same for the involuntary and non-voluntary, so on and so forth, right? So just so you get sort of a rough feel, the least controversial of the voluntary types is voluntary passive euthanasia for physical pain. This is something that's already legal throughout the United States. Most people accept it as something that's morally permissible. Right? If all we need to do is remove your life-saving treatment and you prefer to no longer have life-saving treatment given to you, that's morally permissible. The most controversial so far is voluntary active euthanasia for mental pain. Right? So where a doctor has to help administer a drug that would kill you just because you have some mental suffering that is not terminal. Okay, and then non-voluntary is also controversial, but we're not going to spend a lot of time on it because a lot of the arguments which would justify voluntary euthanasia seem to justify some non-voluntary euthanasia. And then we're also not going to focus on involuntary euthanasia because that's just not controversial. Most consider it clearly morally wrong, and in fact, we'll look at a number of arguments later on where people say we shouldn't legalize voluntary euthanasia because this could lead us to cases of involuntary. Here, you've read this in the book, so we're not going to spend a lot of time, but there are a lot of reasons someone might want voluntary euthanasia or physician-assisted suicide. It can be pain-based. It can be dignity-based, right? You want to die on your own terms. You don't want to burden your family. You don't want to be sort of bedridden. You want to have your freedom. You just want to die in a way that you find acceptable, given the way you've structured your life. So one thing you should think about is, could you ever find yourself in a position where you think your life is no longer worth living? Would that just be for you in cases of unbearable pain and terminal illness, or could you imagine the mental suffering getting that bad? And then finally, just so you can know where we're at, in the current landscape in the United States, voluntary passive euthanasia is legal throughout, but voluntary active euthanasia is illegal throughout. Right? So in no state in the United States are you allowed to have voluntary active euthanasia legally. But physician-assisted suicide has become legalized in Vermont, Oregon, Washington, California, one county in New Mexico, and de facto legal in Montana, which essentially means no one prosecutes people who do it. But physician-assisted suicide isn't legal for mental pain anywhere in the United States because most of these states have a legal clause which requires the patient to have a terminal illness. So if you want euthanasia or physician-assisted suicide for mental pain, your only options are Belgium and the Netherlands. So in the next lecture, we'll look at the major arguments for both voluntary active euthanasia and physician-assisted suicide. Thank you.